Sean from Aquatic Sports Performance here. Today we're in Montclair, California at the PFA Sports Academy, where we're going to be assessing some of my injuries. We'll test my pitching velocity, and we're going to train with a doctor of physical therapy.
Live long enough.
That's 70.
70?
Yeah, that was good.
Dude, 13-year-olds are doing that.
Yeah.
All right, we're here at the PFA Sports Academy in Montclair, California with Dr. Zach Leal. So basically, it's 100% a jiu-jitsu related injury.
Okay, cool.
So it's like, it's not overuse or anything. It's straight up like trauma. Not trauma.
Are you still rolling?
Contact, yeah.
Oh, you are?
Yeah.
Okay, sweet. How many days a week?
1 or 2.
Sweet.
Yeah.
Okay.
So right now I have a little bit of collarbone pain. It started off on both collarbones. Right now it's just my left one. Whenever I elevate right here, like I can feel it right there. Like I got a little bit of pain right there. And this one, I'm pretty sure it's from not tapping early in a triangle choke. Like I refused to tap last week, and I could feel something going on in my neck. I was like, ah, and like not tapping. And then ever since then, like it was both collarbones at first. My right one's good now, but then my left one, like it still hurts when I elevate, end range elevation. Okay. And then when I'm swimming and I actually do the pull here, I feel some pressure right here.
Cool.
After explaining his injury to Zach, Zach asked Sean routine questions to ensure Sean's basic bodily functions like breathing and using the restroom are working properly. Zach also mentions that the side of the injury isn't always the cause of the injury and that the side of the pain may be coming from somewhere else. In fact, Zach explains that Sean's injury may not be a shoulder injury. When dealing with pain in the shoulder area, Zach will also check out the cervical and thoracic spine. He also mentioned that neck training could play a role in preventing these kinds of issues in the future.
Good. Come back up. You left-handed?
Nope. Right.
Sure.
Yeah.
Right shoulder. Pain?
Zach then observes Sean's pain, movements, and tissue quality.
Left to your left shoulder. Okay, come back down. Do that a bunch of times, they'll tell you to stop. Any pain?
No.
Here, Zach discovers something interesting with Sean's tissue quality.
Yeah, it's one of those muscles that, like, when I notice that people have neck pain, it's one of those muscles that I always kind of check and just to kind of see, just because it's...
When you check it, you're checking length or...
Yeah, tissue quality, just like how it feels.
Yeah.
Like, see, it's very smooth.
Yeah.
You don't really have much going on underneath here. And then when I go on this side, like, it feels kind of gunky.
Oh,
doesn't really feel great. Tissue quality feels a little bit more poor.
Interesting.
Do I think that matters? Yeah, to a degree. Do I think that it's like causing your pain? Not really. Just something I'm keeping in mind.
I see.
As Zach continued to work on Sean, Zach mentioned something very important about rolling out the pecs, neck, and groin areas at home.
And if your arm starts going numb, let me know.
So for like home intervention, just like take a...
No.
Not this out the clavius? Okay.
No, sir. Yeah, disclaimer.
No
lacrosse ball. Yeah, no lacrosse ball to the pec. I don't even let people roll out their pecs, really.
Really?
Yeah, because right underneath your pec minor is you have your brachial plexus. So when people get into their pecs, the only thing that they know how to do is compression this way. But anytime you go in this way, you're compressing all the nerves and everything like that. So it takes some skill. But like if I were to say there's like, I would say probably 3 areas that like I don't let people do on their own. It's like this quadrant of your shoulder, any neck stuff, and groin stuff. Like those are the areas, just because there's a lot of anatomy that people don't take into consideration.
I think I've been messing with it at home.
Yeah, right. Well, I mean, you can test on your own, and you kind of know, like, if your leg starts going numb, you're like, that's probably not a good idea. Yeah. There's certain things where I'm just like, nope, you're not doing that on your own, and that would be one of those areas. Okay, retry.
Maybe we can create Yeah, it feels better. But I'm also not fighting gravity right now, so I don't know if it's...
But that's the thing, though, is that even if we took out gravity and you still had pain to start, that means that it's a little bit more provocative than you think it is. Yeah. So I always want to test and retest in the same position, because then if I just have you stand up and do it, you're like, oh yeah, I feel a lot better.
We then transition to work on Sean's back. Zach discusses that he checks the tissue quality of the whole body regardless of the site of injury. Zach then mentions that the central nervous system plays a role in injuries and how it'll manipulate tissue quality and movement.
I tend to think that if something kind of gets locked up or injured or anything like that, I think the brain plays such a big factor that I think people overlook it from a tissue quality standpoint.
The nervous system controlling the muscle tension?
The tension, the mobility, the ability to perform a movement. anything of the nature.
You can down regulate it for whatever reason.
Most of the time it's upregulated so that you feel it more. So that's like why I like the pain pathway and your experience of pain as a patient really matters, because it's like, hey, like your body's basically telling you to not do this.
Right.
Okay, cool. But like, hey, for jiu-jitsu, I need to be able to do this. Like, okay, cool. Like your willpower versus your pain is going to always probably win.
Yeah.
So at that point, it's like, okay, like, can we downregulate the nervous system, or like, why is the nervous system upregulated? Can we downregulate it? Cool. Intervention then replaces that, and then you probably feel a lot better. Up top. Anything?
No.
Nothing. And up here, nothing.
A little bit.
What would you say? Like
It's like a 0.5 out of 10.
Okay. All right.
I can feel something.
Yeah.
No, but I feel a stretch posterior shoulder.
But no pain in the front?
No.
0?
0 pain in the front.
Pain in the front?
No.
Oh. Interesting.
What did you
Your
see?
lats are fried over here.
Lats are fried?
Yeah, dude.
How are you able to tell that?
Okay, so it's a length tension basically test. So scap, I kind of put my palm right in there, and then I'm just trying to kind of see like where your shoulder kind of falls.
Yeah.
So here, that's about as far as I can go. I'm not trying to like force you down this way and stretch.
Yeah.
It's more the fact of just trying to kind of play with this relationship between.
So you're stabilizing the scap
here.
so it doesn't move, and then let the arm fall to see the length of the lat.
It's not more of a stabilization here. It's just I'm trying to kind of figure out like right where, because like what would that be? The lateral border of your scapula. As I take you into upward rotation, it should come with you.
Yeah.
Right?
Yeah.
Into upward rotation. So I'm trying to kind of see like where does that like bounce into my hand? And I'm kind of going, and I kind of have this like I kind of press and I kind of reach all at the same time. And it's one of these like, again, I've done it so many times. I'm trying to explain it to you, but it's just I kind of just hold it, and then when I go there, and then I'm not forcing you, I'm just kind of seeing where you're stopping.
Yeah.
Even here, just kind of holding it, I would say probably about right there. I mean, that's 100 degrees of flexion-ish. I mean, that's already past.
Oh, interesting.
If I go here, relax. There you go. So about right there. That's right where it starts to pop into my hand. So if I go here and just kind of wiggle, you can kind of feel the pressure into my right hand.
I see.
Starts to go there, and then posterior shoulder, posterior capsule, horizontal adduction. Ideally, most people, I want somewhere in the book says 45 degrees. That's here. No overhead athlete's gonna get that unless it's on their non-dominant side, but for you as a swimmer, you're a bilateral athlete, it's like you even getting to 0 is pretty tough. So like, hey, posterior shoulder probably needs some work, but like for you, again, when we're talking about shoulder and clavicular stuff, like if you can't get upwardly rotated well, that's just gonna put more strain there. Again, but if I'm forcing you here and then compressing your neck against your shoulder, I don't think your lat really is gonna have much to do there. But what I can tell you is that if you just give yourself a little bit of help over here, probably make things feel a little bit better.
You mean help as in lengthen the lat and tissue quality of the lat?
Exactly.
Okay.
All right, let's see if your 0.25 went away.
Make me sound like a baby.
You are a baby.
Actually, yeah. Yeah. It's like 0.12 now.
Hey, that's 50% better than when we started. So I always tell my patients, if I can get you down 10%. Every time I see you, then
eventually it'll be 0.
I'm a master of my craft at that point. Anything more than that, then I win. But other than that, so I would just say like wrong place, wrong time. Learn to tap. It might help you out a little bit.
Yeah, that's my lesson I took away. Is just once I'm in it, just tap.
Yeah, I mean, there's something to be said, and like if you're working on trying to get out of like your vulnerable positions, there's something to be said there.
Yeah,
Don't get me wrong.
Is just ego and.
So gonna come from our trusty internet warrior Cam Haynes. So it's 100. I think it's 150 bench and 150 pull-ups.
Holy. Okay.
Broken up however you want.
Okay.
So let's do 100.
Okay.
Let's see if we can get to 100. So flat bench, we'll do flat bench at 50s.
Yeah.
And then we'll do 100 pull-ups and then break it up however you want.
Okay.
Just super bro out session.
Yeah.
Is that cool?
Yeah. Can I throw first before we do that?
Sure.
Just for fun. Just for fun.
Oh, that's 100 for sure.
100, right?
Oh,
that's
easy.
What I'm saying. I'm gonna throw. Take a guess. What do you think? Yeah, take a guess on the miles per hour.
I think you'll max out at 75.
75? Okay.
Exactly. What do you think you'll max out at?
72.
72?
Yeah.
Bro, I was thinking like 94.
68.
68? No way.
That's 70.
70?
Yeah, that was good.
Dude, 13-year-olds are doing that.
Yeah.
Doesn't AJ's
Bro, AJ's brother throws like close to 80.
80?
Yeah.
Holy, okay. This is way different than I imagined.
Yeah.
Anything form-wise that makes it go
I would
faster?
spend less time to try to build energy. Just go quick.
Less time building.
Yeah,
Just
you're
go.
like super slow and trying to
okay.
throw hard. It's more of a just go.
Just go.
Yeah, just go.
Okay.
Sure. There you go. Already faster. 71.
Dang, you're a pitching coach. my hand's starting to hurt.
I was gonna say it's some numb. Yeah.
Yeah. Is that
Nerves
normal?
are. Yeah, your nerves are getting shocked a little bit.
Yeah, like right here, I feel like
Might
it's
be
a
some
little
median
bit-
nerve stuff.
I'm gonna stop there.
Yeah, so 71. So I was off by 1 mile an hour.
That's wild. I thought I was gonna go at least 80.
No way.
No, there's somebody
Okay.
that rolls off the street, never thrown a baseball before, and throws 80. Then I'd be like, oh, okay. Now we're having a different conversation.
Yeah, I have a lot more respect for baseball pitchers now.
And this workout for any master swingers or?
No, this is a pure bro session. We haven't worked out together in a while. And then, I mean, like my honey hole is a little bit more CrossFit based. So it's like one of those workouts I've always been like, this would be interesting. I wonder what I can do around with that. So we're gonna see.
Yeah, I'm really humbled with the 72 miles per hour. I really thought I was gonna come in here and just throw 80.
Dude, imagine.
How do you feel about bench pressing for overhead athletes?
It's the worst thing ever.
Actually?
No, it's not the worst thing ever. I just think it's overprogrammed. And it
Especially
depends on
baseball.
what movement you're trying to do. Like if you're trying to be a swimmer, that's one thing, because I think it matters from an internal rotation standpoint. From a baseball player, like I think it matters to a degree. I just think that like, again, just everybody's an expert. So it's like, hey, like, do you need to bench press? No. Like there's those people that are like anti-bench press for everything, right?
Right.
That's like probably not the best idea either.
Yeah.
I think it's a necessary like thing that you need to like learn how to do well.
Yeah.
Because I think it goes into athletic development. But at the same time too, is like, do you need to bench press 15 times a week in order to build XYZ? Like, no, I don't think so.
You think it can exacerbate pain if you have pain more?
Depends. So like for me, like the rotator cuff takes the biggest beating from bench pressing. Everybody's like, oh yeah, it's a pec exercise. Like
The posterior cuff?
yeah, so from an EMG standpoint, your infraspinatus has the highest EMG activity during the bench press.
Really?
Compared to the pec, compared to the delts, compared to anything else. So
Is it because it's stabilizing?
yeah, basically, yeah. Because I mean, like any upper extremity thing is like the body again is just trying to keep the body in the or the ball in the socket, trying to make sure you don't dislocate your shoulder. Like that's what the brain's gonna do.
Right.
So from a bench press standpoint, it's like it's the whatever the Newton law is, like equal and opposite reaction. So if you have all the anterior musculature doing something, the posterior has to do something to
be
stabilize
active,
to do that. So then when you start talking about the surface area of your pecs and your delts versus your posterior shoulder, like that's going to be a losing battle all the time.
Right.
So like most people that have pain when they overhead press or bench press, it's not a shoulder issue. Well, it is a shoulder issue, but it's a rotator cuff issue most of the time.
You said we're going 20 sets of 5?
Probably. That would be like a good goal.
5 sets of 20?
Yeah, right?
Yeah, I can feel, so like when I'm hanging at end range,
You can still feel it?
I can feel the collarbone.
Interesting. I'll be curious to see what happens if it gets worse or gets better with these just in general.
I should cut the range of motion a little short, so I'm not.
I mean, from a test perspective, I almost don't want you to, because I want to see what happens if it gets worse. Because it would be one of those things where like, I wonder if it's going to get worse with the more that you do.
Yeah.
Or if it won't and actually feel better. Because then that tells you it's like it's a mobility thing or it's a muscle thing.
Yeah. Starting to feel, I think we're around 10.
I was gonna say now, I think the workout starts now.
Yeah, it's starting now. It was pretty easy until now. And my right lat is still quivering from the baseball throw. The collarbone feels exactly the same from the first
At that point,
set.
then I don't think it's a muscular thing. I think the muscle thing could like play a factor.
Yeah.
But now that we've done so much, and I'm like, okay, cool. Like it probably just got aggravated. So at that point, it's like, yeah, like for you, I would definitely take care of the soft tissue stuff, take care of the lat stuff, and then just give it a little bit of time. But
Yeah, when you say take care of lat stuff, it's like,
yeah, Yeah,
roll.
just try to make sure that you're giving your shoulder a fighting chance.
Okay.
Because like again, it's like if it was a muscular, like if it was like a purely muscular, like a strain, let's just call it that.
Yeah.
In theory, it would get better with more muscle like activation or blood flow or whatever. That should get better over time. It might not feel like perfect, but it'll feel a little bit better just because you're warmed up and you're moving.
Yeah.
But now that it's not doing anything, then it's like
it's pretty stable.
yeah. And then at that point, I'm like, okay, it might be something else.
So we do a lot of gymnastic stuff for our like kids, you know, L-sits, handstands and stuff. How do you feel about like handstands and that kind of stuff for high level athletes?
I would say you need more definition around that question. What I mean by that is I'm a big component of kids trying to diversify their movement as much as possible.
Yeah.
As much as they possibly can. So, okay, let's take that, set that off to the side. High level athlete, like, okay, what does that mean? Does that mean sport specific? Does that mean
let's say take an MLB pitcher?
Then no, yeah, it'd be pointless. Just because it'd be they're putting so much time, energy, and demand on the upper extremity that movement, I don't think moves the needle for them to help them perform on the mound.
Okay.
Or,
what about off season? You know, they're just trying to stay in shape.
So then that kind of goes into the definition standpoint. So it's like, okay, hey, we're using gymnastics to try to get their more body awareness or trying to get them more diversified with their movement. Okay, cool. That's great. Are there better opportunities with a lower barrier of entry in order to accomplish that? I think so.
Okay.
Olympic lifting. That's like the biggest clickbait thing, anything ever, right? I think it's the most amount of technique for the least amount of needle moving possible. Unless you're trying to be an Olympic lifter. So can I perform or can I do power stuff in a way better variety? Absolutely. So, and then again, now we just need to get better definitions around like, okay, like what does that look like for you?
Right.
For an 8-year-old kid that like doesn't even know what sport they want to get in, absolutely. Flood their nervous system with as much as possible. And then whatever they tend to do, they'll probably tend to be okay at it.
Right. You hear of anecdotes though of like person retires from a sport, they go train another sport, they become more athletic, they come back to their sport, and they actually improve in their sport.
Absolutely.
You know, so Cam McAvoy, right? He did that. He did rock climbing for a little bit. For Mountain Dew. I did strictly Olympic weightlifting for 2 years. Jiu-jitsu, came back, saw best times.
All for the content.
19. 100.
Okay, these are getting hard now.
That was the last one, no?
Was that 20? Oh, okay. That was nice. There we go.
Good job.
That's work.
That was fun.
It's a good bro out session.
Hey, Zach. Thanks for all the help, man.
Oh, dude, of
that was a
course.
fun workout.
Yeah, it's a good time.
We got some tips on how to treat my collarbone. Obviously, we crushed that workout. Got humbled. Obviously, I didn't throw 80 miles per hour, but that'll be in the next vlog. If people want to come and check you out, where should they go?
Yeah, pretty much all the social media platforms are Forged PTP, Instagram, TikTok, stuff like that. Yeah, that's if anything that I can help out with, feel free to reach me out or whatever I can do.
Yeah, so Zach is one of our, we collaborate with a couple PTs, but Zach's one of our trusted PTs that we send our athletes to. I think that in the baseball world, you're literally dealing with shoulders that are worth millions of dollars. And so obviously swimming is also a, high shoulder injury prone sport. So sending our athletes to you, we definitely put our trust in you. So
thanks, man. I appreciate that. It means a lot.
If you guys like that video, like and subscribe. We come out with new videos every week.
There we go.